can tell you, and do so with sadness as always, that there have been a further 6 deaths of patients who have tested positive for coronavirus, which takes the total number of deaths in Scotland to 22. And I want to extend my sincere condolences to all those who've lost loved ones. I can also give an update today on the numbers that we know are being treated in intensive care. As of last night, there were 51 patients with COVID or suspected COVID symptoms in our intensive care units, and I'm sharing that information to demonstrate and underline how serious this virus can be and why the measures that we are asking people to follow are so important. Of course, that is a number that we would expect to see rise in the days and weeks to come, and that also underlines the importance of the work that has been done to increase the capacity of our National Health Service. And let me take the opportunity now again to thank our NHS staff who are working incredibly hard, doing an incredibly courageous job in these circumstances and continuing to care so well for people suffering from this virus. As we've been saying over the past few days, it is clear that we are now seeing a rapid rise in coronavirus cases in Scotland, and we have sustained evidence of community transmission. So I want to make clear again to people across Scotland that it is vitally important that these unprecedented measures that we're asking people to comply with are complied with, and that people observe and follow the advice. So can I thank people across Scotland who are cooperating and showing support in what is a very difficult time for everybody. If I can turn now briefly to the economy, I want to again say thanks to businesses who have heeded our advice over the past couple of days to close and to allow their staff to stay at home. Although the vast majority of businesses have behaved responsibly and heeded the advice to put the health of their workers first, I do remain concerned that some workers have been put under unnecessary and unacceptable pressure regarding their terms and conditions. So we have prepared further guidance for employers, which is being published today and follows the statement I gave in Parliament yesterday.
The supply chain is working well, and we currently have no shortages of particular supplies like the masks and aprons and gloves and so on that are needed. What we also need to make sure, though, is that the clinical guidance that does exist is very clear to each part of the health and social care sector,